Babukele nginibingelele kuzo zonke izindawo lapho nibheke khona uhlelo yilungelo lakho. It's your right. Bukele sisakaza kuwe bukhoma la kumahamba phambili SABC 1 eMzansi for sure. Uyazi mbukeli njengenjwayela sikuvaleli phela ngaphandle ngokuhamba kohlelo sizokuvulela izingcingo ukuthi phela nani nisifonele nibuze imibuzo futhi niphinde nibeke nembono yenu ngodaba esobe silidingida namhlanje. Izinamba zethu zase studio 0117146819 noma 7146919. Ungasithola kwi-email ku consumer@sabc.co.za. Siyatholakala futhi ku Facebook na ku Twitter. A very good afternoon to you. Udaba lethu la namhlanje mbukeli, hunger is a real phenomenon. Ask the more than 12 million South Africans who go to bed on an empty stomach. Now this despite the fact that the country produces enough food to feed everyone, but food wastage, climate change and the escalating cost of living are the main threats to food security. And this state of affairs is not unique to South Africa.
The food business remains one of the fastest growing sectors in the economy. Evidence of this is not hard to find, as almost every street in a busy area like Johannesburg boasts an eating outlet that serves a growing clientele. However, the abundance of restaurants hides a shameful reality about our food wastage. At least 9 million tons of food goes to waste, while millions go without food every day. Ironically, South Africa produces enough to feed everybody. A study by the Human Sciences Research Council says more than 25 million South Africans do not have access to sufficient food. This means that a large chunk of the population experiences hunger at some stage of their lives. Experts in the sector blame this state of affairs on food wastage, low agricultural productivity, as well as climate change. Producing enough food and preventing climate change from getting worse is one of the concerns facing the country. The Agriculture Research Council says the capacity to produce and deliver food to people is hampered by the fast rate at which the population grows. If this trend continues, developing countries could plunge into one of the biggest food crises in history. Throwing away food and producing too much than we actually need has been identified as one of the threats to food security. The poor handling of post-harvesting, insufficient storage facilities, and consumers buying more than they need sees millions of tons of food going to waste. Another contributing factor to food waste is the threat to the environment caused by food dumped in landfills. One example is the excess crop farmers could not sell and dump in landfills. Here, food decomposes and releases toxic gases into the atmosphere. This contributes to global warming. Global warming, in turn, contributes to climate change, which is the reason our weather patterns are negatively affected, threatening the amount of food farmers produce. To reduce food waste, consumers are urged to buy food that is produced closer to home. This will reduce the chances of food getting spoiled during transportation. Consumers must also store food properly and buy only what they can store without going to waste. Consumers are also advised to cook only what is enough to avoid throwing away food. And if you have more than you need, donate it to the needy before the food expires. And the success of all this rests on you, the consumer. YilungeloLakho.
Sibonge kakhulu ngombiko esiwenzele uVuyisile Mdoda. Manje ukukhuluma kabanzi ngale ndaba yokuncipha kokudla emhlabeni kakhulukazi kubantu abampofu. Asamukele izivakashi zethu. Let's extend a warm welcome to Dr. Suzanne Ulofsa. Yena ohola iqembu eliphenya ukumoswa kokudla i-Council for Scientific and Industrial Research. Asamukele no Professor Selma Brody. Yena ungumkhankaso we-Operation Hunger. Sibe naye futhi Andrew Magadlela yena ozosjoina later on in the show. He's the General Manager in charge of animal production at the Agricultural Research Council. Ladies, a very good afternoon to you and thank you for joining us on YilungeloLakho.
Thank you for the opportunity.
Dr. Suzanne, let's start with you. Tell us a bit about the Council for Research. What is your speciality?
Okay, I'm going to focus on the work that I do because the organization obviously covers a lot of things. But specifically what I'm busy with is research in food wastage. In general, I look at waste management, also the governance environment associated with waste management. And then in 2010, when I attended a conference in the UK, one of the researchers there asked me whether we are not interested in looking a bit more into food wastage, because they found that in Europe that's a big issue, and they found that in England, as much as a third of all the food that people buy actually goes to waste without being eaten. So they are trying to put together assumptions internationally to see what the global wastage is, and they don't have any good information coming from a developed or a developing country. So therefore, we decided that it's also interesting for us to see what South Africa's contribution is to the overall picture. And since we struggle with the reality of people going hungry, being a producer of food as well, we thought it would be interesting to look into this. So therefore we did the study, we did calculations basically, where we took what is produced currently in South Africa in terms of food, certain food groups, and then based on international research, added the percentage of wastage at each stage in the food supply chain, from agriculture right through to consumer consumption at the end, and we did the calculation. And if we add into that calculation the amount of food that is imported and exported from South Africa, then we came to a figure of close to 10 million tons of food wasted every year. And to put it into perspective, that's about 7 kilograms of food wasted per person in South Africa every year.
I was about to ask for a very practical example there, Dr. Susan, but we'll get into the details of that a little later on. Professor, tell us a bit about Project Hunger. What is Operation Hunger all about?
Well, Operation Hunger actually started in 1978. I started with Dr. Motlana, who was well known in those days, because there were tremendous droughts. And the idea was not just to give food, but to teach people how to grow food. You know the old story of you give a fisherman, you don't give people a fish, you give them a rod.
Absolutely.
But you can't give everybody a rod, so you've got to balance giving food kitchens and things, soup kitchens, and while you are helping them develop ways of growing their own food. Now, Operation Hunger was operating from then. I handed it over to the Institute of Race Relations in 1980, and they've been running it while I was doing other work, but I'm now on the board. And what we are finding with our projects, particularly we're working at the moment in the rural areas, it's not just hunger. It's a spectrum. There is real hunger where people, as you said, go to bed with an empty stomach.
Stomachs.
But the other thing is, there isn't good nutrition. So even if people can fill their stomachs, they can't fill their stomachs with the right kind of food. And it's actually devastating the rural areas of South Africa. The rate of TB, HIV, other illnesses, it's in the townships as well.
True.
And it's due to many factors. And the factors are firstly ignorance, because they don't know. People, how should they know?
They don't have the information.
It's not healthy. For example, here you see workers having for lunch white bread and a Coca-Cola. They don't understand. There are many things that you have to teach with nutrition. Another thing that's neglected, when you're dealing with illnesses like HIV, AIDS, TB, and others, nutrition is vital.
Absolutely vital.
And we find that all these wonderful organizations, the medical ones, donors, give a lot of money for drugs, or for everything that's needed medically. They don't realize that often it's the nutrition that kills people.
Absolutely.
And we've had experience. I've had experience training in other spheres, in home-based care, in various areas, where people who are on drugs can't take them because they can't take them on an empty stomach. Or we can tell you how many cases are not dying of AIDS, they're dying of malnutrition. And this is not recognized. So it's a tremendous job to get this education across. Now, Operation Hunger has, at the moment, working with projects in 6 provinces, but they're small, relatively small because we don't have funding. And my very big, I don't say complaint, perhaps it is, the local government does not support us. They use us, they see what we're doing, but they don't give us any support. The Department of Agriculture should be partnering with us, but we have never, Operation Hunger, when I say we, I'm only on the board now because I have another NGO, which I'll mention a little later. Perhaps I've told you enough to start with.
Thank you so much, Professor. Very insightful there. Now, Dr. Susan, with that being in mind, a lot of people don't understand how vital nutrition is. You can have food, but you're not having the right nutrition. Tell us, in basic, what is food insecurity?
Food insecurity is having access to food or having the means to buy food. So if you don't have that means, then you come down to food insecurity. And it also means that you perhaps don't have the right kind of nutrition available in order to feed and become healthy. So that is what food insecurity is about.
Is all about. All right, let's hold it there. Okwamanje mbukela ake sithi shelele ey'tolo kodwa ngaphambi kwaloko ithi nginikhumbuza ukuthi phela ungasishayela ucingo. Studio numbers are 011-714-6918, 714-6919. Usithumele email consumer@sabc.co.za. Usithinte futhi na ku Facebook na ku Twitter. Ngizobe ngifunda imibuzo nembono yenu ya ku Facebook na ku Twitter mesibuye emva kwaleli khefu ngendawo. Mbukeli, welcome back. Sisakhuluma ngezinto ezingenza ukuthi sizithole sikwisimo esikabi phela sokushoda ngokudla eNingizimu Afrika nasezweni lonke. Abashayeka kakhulu ke ekushodeni kokudla ngabantu abantulayo. Namhlanje sibheka ukuthi wena ungadlala yiphi indima ekuvimbeni ukulahlwa nokumoswa kokudla. Sishayele ucingo mbukeli usithinte ku Facebook na ku Twitter. Ake sibone ukuthi nithini lapho ku Facebook na ku Twitter. Nangu umama Mphole Khotso Monama uthi I think our municipality at our rural areas must create jobs or some project for our sake like others. Thank you so much, Mama Mpo, for that comment over there. Ndumiso Misomantic Mali says, it's so sad that even now, Mzansi, there are still people going to bed on an empty stomach. Uhulumeni magadali imisebenzi for abantu bakithi, please. Siyabonga kakhulu Ndumiso Mali ngaloyo mbono wakho. Asathu zamani mhlaba olundu uthi sanibona ukudla kuningi kakhulu eSouth Africa. Inkinga kuyabiza and abantu abaningi abasebenzi kodwa banokuba abantu balale bengadlile abathathe amageja bashone emasimini phela ukuyolima. Siyabonga kakhulu Zamani Olundi. Thank you so much for all those comments. Well, basically ladies, our viewers are saying that food has become so expensive in South Africa and that government must create more jobs, but our final comment there is saying that people should really stop complaining about being hungry and go out there in the fields and start planting their own food. Now ladies, let's move on to the next segment. What are the common threats, Dr. Suzanne, that threat the nation's food security?
I would say climate change is a very big threat to us currently, but also if I just think back to our consumer-driven society that we live in, we have become used to throwing away stuff very easily. So therefore also in terms of households, we don't necessarily taste something when it's in the fridge to decide whether or not it's good.
Yes.
If it's past the use by date, then we just throw it out. And I think it's things like that that also threaten our food security.
Is there anything you want to add there, Professor? Basically, how do issues like climate change, diseases and political instability affect the average person?
Well, it does affect the average person, but even with that going on, there's still a lot that can be done. For example, one of the comments was, why don't you create jobs for people or projects? That's exactly what Operation Hunger is doing. SPAR, the organization called SPAR, supports certain projects in rural areas. What they do teach them is, first of all, don't tell people grow your food. They don't know how. So we have to provide them with fertilizer.
skills.
Then you have to provide them with implements. Then you have to teach them how to do it.
Skills.
Then you provide them with seed. Then you have to water.
It's a long process.
Water is a very serious issue in some areas.
Even
And so
land,
what Operation
Professor,
Hunger
people don't
does-
even have land to go farm at. I think that's one of the big issues as well.
Yes. So what Operation Hunger does, it sees that the area in which they're working has water. So either they teach people to build themselves water tanks where they collect rainwater, then they can do boreholes or repair old boreholes. There are different ways. You've got to provide water.
Absolutely.
So it's not simple, and that's why you need Department of Agriculture to come in and
Absolutely,
partner,
yes.
so you can broaden the scope of what they're doing, partner with other people, have a whole national plan using the skills
Absolutely.
that Operation Hunger is trying to use and to teach.
Thank you so much, Professor. Let's take Sipho from Durban. But Sipho, sekwamukela ohlelweni?
Sawubona kunjani sisi?
Siyaphila bhuti wami, sicela uqhubeke ngombuzo noma umbono.
Okay, ukhuluma noSipondima eMonde esigodini sakwamaqhangi.
Awu, qhubeka nsizwa.
Ngiyamuzwa insizwa leyaSolundi lapha ku Facebook. Uhulumeni la emakhaya uyasiza, uyasupporta ngokuthi asilimele mahala, asitshalele mahala. Emva kwalokho thina siwumphakathi bese sidla njengeenkomo, singabe sisakhona ukuyodla ngendlela, sisike abantu qhamuka sebeyaqhamuka bayabhonyula emasimini, kanti kuba sidla ngendlela emasimini sisi. Ngiyabonga.
Siyabonga kakhulu, but Sipho, well, Sipho is basically saying that government is helping out with some of these plantation projects, but it's the people, whenever they have access to these fields, they become either greedy or they just don't share the food in the right manner among the right people. Now, Dr. Suzanne, in terms of waste research, how is it that so much food gets wasted, thrown away, instead of being made to go further?
Well, first of all, we must understand that the food that we find on the shelves in the shops are basically what people buy. So it's consumer demand that drives what gets put on the shelves in the first place. Therefore, you will, for instance, not find a crooked cucumber on a shelf on a shop shelf nowadays. And that means that all crooked cucumbers gets thrown out right at the start at the farm already, because it's not something that the consumer would be interested in buying.
So what happens to that food?
That food goes to a landfill. If we are lucky, it will be ploughed back into the lands to refertilize the soil, or otherwise it can go to composting facilities, but quite often that food is good enough to eat.
Absolutely.
There's nothing wrong with the quality.
It's just the shape.
It's just the shape.
Oh
or for
my.
instance, if there was a hailstorm and the fruit got damaged, we don't want to buy tomatoes that has little marks on them.
No.
So therefore, those tomatoes will not reach the end market.
Wow.
That will also go into informal markets, or rather into
A land refill again.
landfill, or sometimes the food will go in, as feed for animals.
Okay.
But we must also realize that food that is fed to animals must also be of a good quality,
Absolutely. Thank
because
you
it's
so
in the
much.
end the people that consume again the meat that we produce. So therefore we don't want lower grade food to go to the animals, and that is again that contributes to part of the problem.
Thank you so much, Doctor. Let's take Kehla Khozi from Yilungelo. Kehla, are you still with us on the line?
Yebo ngisekhona siseninjani?
Siyabonga bhuti wami, siyaphila. Siyabonga ukuthi ubambe. Sicela uqhubeke ngombuzo noma umbono wakho.
Nginombono sisi wami, ngendlela yokubuhlungu ngayo ukubona abantu belambile while abanye abantu bedla izambane likapondo. Kubuhlungu kakhulu ngempela leyo nto leyo. Abantu bekuchitha ukudla kuma dustbin while bona benokudla okwanele. Masingaba nobuntu, ilento ekuthiwa ubuntu, zwane uphe umuntu ongenako osweleyo noma ngabe into encane kangakanani kodwa uhlebelele omunye umuntu.
Siyabonga kakhulu bhuti Kehla eLyondale. All right, thank you so much. Now, I just want to understand, Professor, is it safe to say that we can't determine how population grows, therefore meaning the food security threat will always be a looming factor?
Well, when you say always, you mean you don't think the government or any government will do anything about it.
It seems we're producing enough food for the nation, but not everybody is getting that food.
That's right. That's right. Of course not everybody's getting that food. So that's why you need a strategic plan to be in place. But another point that you said about the quality of the food, you know, when food is grown wherever, in a farm, firstly, be sure that that soil is good. If the soil is not good, the quality of the content, the nutritional content. But if the soil is good and it's transported from the farm to the market, it can lose a lot of nutritional value on the way. Then it hangs around the market. Then it's sent to shops. So by the time you get it, and the other very important point is, you know, they often pick tomatoes and other things green. Where do they ripen? In the shops.
In the shops.
You see a yellow tomato going gradually red. So we look for
Very
a red
true,
tomato.
Professor.
Now that red tomato has a fraction of the nutritional value of a tomato that you grow at home and ripens in the sun. So it's a very complex thing with food wastage and quality of food and how to distribute it. But a lot more could be done if they would just make use of various NGOs that knew what they were doing. And this is one, well, perhaps later.
Yes, we'll come back to that,
we'll come back
Professor.
to the diet, people's diet.
Absolutely. Thank you so much, Professor. Well, manje, let's take another commercial break in Bugelunga Indawo. Welcome back Mbukeli. Sisakhuluma ngezinto ezingenza ukuthi sizithole kwisimo esikabi sokushoda kokudla la eNingizimu Afrika nasezweni jikelele. Abashayeka kakhulu Mbukeli ekushodeni kokudla ilabo abantulayo. Namuhla sibheke ukuthi wena ungadlala yiphi indima phela yokuvimba ukulahlwa nokumoshwa kokudla. Sishayile ucingo usithinte ku Facebook, usithinte na ku Twitter. Let's read some more of your Facebook messages now. Siqale ngoPhina Khoza uthi it breaks my heart to hear this when we people are busy throwing food on bins instead of donating it to people in need, and it starts at our community, our neighbor, and we can start to plant vegetables in our yards. Thank you so much Phina Nkosi for lo mbono wakho ovelele. Asithatha uzile Chris Qeshile uthi yena, as we are agricultural entrepreneurs, in order to prevent the loss of food, do we have to be educated in order to know more about this situation? Or are there any contact details that would assist us about more information? Uzile Chris, nangu Professor Selma uzokuphendula umbuzo wakho. Professor, please go ahead and answer that question.
Yeah, well, more education is vital, actually. You know, the eating habits of people, which I don't understand, is destroying the health of our population. I'm not only talking about people who can't afford it. It goes across the board. But take sugar, for example. Sugar is killing our people. The rate of obesity, why? Because they eat the wrong things and too much sugar in everything. They bring up the children with these cereals full of sugar, everything, cold drinks full of sugar. The rate of diabetes has become an epidemic. And diabetes causes heart problems. It causes problems where you actually in the end can lose your limbs, your kidneys get damaged. It's a very serious illness. So a lot of the sickness that we find in the townships or I'm talking about the population in general, is due to not understanding what good nutrition is. And just to tell you what we've tried to do, you know, I'm a medical doctor, and when I retired from my position at the university, I went into community. I've always worked in community. And I started something called community action, which it's a mobilization and basic education model to impact epidemics like HIV and TB, and also other health issues. And one of the most important things we teach is nutrition, and to understand why and what, because you know it's no good telling people what to do.
Absolutely.
If you tell somebody don't do this, don't do it, they don't listen.
They want to go into it.
They have to understand it.
Absolutely.
So it's very important. So we have a model using street committee people whom we train, and they learn enough to go into every household and teach the people about germs, nutrition, and various other things.
Wow, that's
and
a
now
great
we have
initiative,
partnered
Professor.
with Operation Hunger. So where they work in the rural areas, this model can be brought in to teach the people. So it's not only teaching them how to grow food, it's teaching them about nutrition. And then we've asked, Operation Hunger will come into our urban work that we do with community action and teach people in the townships how to grow, if they haven't got yards, as they call them, or a little patch to grow tomatoes and morocco, whatever it is that you grow, and when they learn what they should plant, they can do it in flower pots, just enough if they're in shacks. So there's a lot that can be done.
Thank you so much. Now, I know, Doctor, you wanted to add something before we went to the ad break.
Yes, what I wanted to add is people don't realize how they also deteriorate their own food quality by not maintaining the cold chain when they buy food. Typically, when food is harvested, it should immediately be kept at a cool enough temperature to enhance the longevity of the food. And then it gets into the shops and onto the shelves. And from there, we take it out, go into our cars. The cars stand in the sun. We drive around. And we don't look after the cold chain after we've bought the food. And therefore, we actually also impact ourselves on the quality of the food that we eat.
Now, Doctor, the food trends status in South Africa is measured or classified under 3 sections: food secure, at risk of hunger, and experiencing hunger. Please try and explain those for us.
Well, to me, that's a bit of a difficult question to answer because it's not my field of expertise. So I would actually rather prefer not to answer it at this point.
Okay, let's talk about your conference that you had last year. What was the main focus of that conference, and did you achieve your objectives?
The conference last year, if you refer to the food security conference that I attended in the Netherlands, it was an amazing conference to attend because the theme was food security, and it drew people from different backgrounds. We had people from agriculture there, we had scientists dealing with food sciences.
Hold it right there, Doctor. Let me take a caller very quickly. Musi from Guatemala, siyamukela YilungeloLakho.
Yebo, kunjani mama?
Siyaphila bhuti wami, sicela uqhubeke ngombuzo noma umbono wakho.
Ya, mina nginombono mama.
Qhubeka bhuti wami.
Ya, ukudla okulahlwayo lokho, yiko ukudla ngabe kuyanceda emphakathini ngoba abantu abaningi bayantula abanakudla.
Uthi bakwenza kanjani lokho bhuti Musi?
Ekhisi mangabe khona ukudla mebe kusalayo umuntu angakunikisa mebe kuma shelter or kuma orphanage home ekhisi kusize ngoba nalabo abame etradini amarobotini abafuna ukudla babudget imali bayisebenzise idakamisweni nasetshwaleni yabo bangathenga ukudla ngawo.
Siyabonga kakhulu bhuti Musi. Wena uyaqhuquzela lokho ngase community yakho?
Yebo ma.
Okay bhuti wami, siyabonga kakhulu, ungawuyeki loyo umsebenzi omuhle wenzayo. Mbukela sithi nje shwi eyitolo siyabuya khona manje ungathi vu. Welcome back, Mbukelo Sabheko uhlelo Ilungelo Lakho. It's your right. Ukhumbule our studio number is 011 714 6819 714 6919. Ungas email ku consumer@sabc.co.za. Siyatholakala futhi ku Facebook na ku Twitter. Ake samukele ke manje, as promised earlier on, asamukele Mr. Andrew Magadlela. He's the General Manager in charge of animal production at the Agricultural Research Council. That is, of course, Dr. Andrew Magadlela. Doctor, a very good afternoon to you. Siyabonga ukuthi uzufike futhi kwilungelo.
Good afternoon, ma'am.
All right.
Ndiyabulela uba here.
Siyabonga kakhulu Doctor. Asiqale lana Doctor, sesikhulumile ngokuthi i-food security, izinto ezimayelana nalokho nokuthi ama research councils enzani. Awusichazele from the Agricultural Council, are we food secure in South Africa? Ithini research?
Abantu abaningi baseMzantsi Afrika ba food secure. Into ye food security ithetha ngokufumaneka kokutya lonke ixesha nangokufikeleleka kwabantu kokutya. Ayincedi into inoba ngaba ukutya kube khona babe abantu bengafikeleli kuko. Xa sithetha ngokufikeleleka kokutya sithetha ngokuthi abantu bayakwazi na ukuthenga, banayo na imali yokuthenga ukutya, loo nto ibalulekile. It is a pie in the sky into bangabuza banokutya kodwa kungafikeleleki. So xa uthetha nge-food security uthetha ngokufikeleleka kokutya nokuba khona kokutya and ixesha lonke. ayincedi into noba ngabo uzaba nokutya today kungabikho ngomso or uzaba nokutya kule nyanga kwinyanga ezayo kungabikho ukutya kufuneka kube khona lonke ixesha yiloo nto sithetha ngayo nge-food security. Izinto ezinxulumene ne-food security zizinto ezifana ne-climate change, zizinto ezifana ne-transport nezinye izinto ezibangela uba ukutya
awusiqalela nge-climate change doctor awusichazele kabanzi ukuthi yini engenza from i-climate ukuthi sishode ngokudla.
Into eyenzekayo ngoku izathi indawo ebesifanele uba ngaba siyakwazi ukukhulisa ukutya okuthile kuba ngaba ii-temperatures aziphakamanga ngala maxesha ii-temperatures ziphakamile so that ukutya besikwazi ukukhulisa kungakhuliseki kakuhle. Yenzeke ngoku loo nto ukuba ngaba amaxabiso ako ukutya abe phezulu. Ngenye ixesha ezinye zezinto esidla ngozenza ke thina kwindawo efana ne-Agricultural Research Council siye senze i-research siye senze uphando ngezityalo nangezilwanyana ezikwaziyo ukunyamezela amaqondo e-temperature or amaqondo obushushu aphakamileyo. So thina ke siyazama ukuba ngaba sikhulise izityalo siveze nezilwanyana ezikwaziyo ukunyamezela amaqondo obushushu aphakamileyo. Ngolo hlobo sincedisana ne-food security yaseMzantsi Afrika.
Nini kwenza kanjani konke lokhu doctor?
Siye senze sithathe izityalo ezithile sizidibanise nezinye senze lento okuthiwa yi-selection. Sithathe izilwanyana ezithile sizidibanise nezinye senze lento okuthiwa yi-selection nalapho sikhethe ke ngoku ezo zikwazi ukunyamezela ubushushu okanye ukunyamezela nayiphi na into esifuna ukuyenza ukwenzela uba ngaba kungathathi ixabiso elikhulu ukukhulisa ezo zilwanyana okanye ezo zityalo.
Now, Doctor, statistics awuzange uzuyibone unfortunately insert, but a big point ebesikhuluma ngayo studio ukuthi ukudla kuyamosheka kuya throw away or kufika kwi-production uthola ukuthi it's not up to standard ukuthi kufike kwi-consumer. I-research yenu ithola ukuthi kubangelwa yini lokhu doctor?
Into yobangela uba ukutya kungafumaneki ngamanye amaxesha into yoba ngaba abo bantu bafikeleleka bakwazi ufikelela kuko abakwazi ngenye ixesha into yoba ngaba kukho abantu abangakwazi nawo ukufumana ukutya. Apha eMzantsi Afrika ubukhulu becala ukutya kukhona kodwa nothi wonke umuntu okwazi ufikelela kuzo. Oku kutya sekulahlayo ezifrijini zethu kungatyiwa ngomnye umuntu izathi asiyazi thina ukuba ngaba singakufikelelisa njani kubantu abakufunayo. Nanso yena ngxaki enkulu. Ngelinye ixesha sikukuba ngaba abantu baseMzantsi Afrika abafuni ukusherisha ukutya abangakufuniyo. Eyona nto idla ngokwenza ukuba kungafikeleleki into yoba ngaba asiyazi ukuba ngaba ngobani abakufunayo. Ngelinye ixesha inqamleko or i-effort efunekayo ukuthatha ukutya kwabo bantu banako ukusa kwabo bantu bangenako idla ngoba ingxaki enkulu leyo.
All right, well, ladies, let's now look into the food price and crisis that is accompanied by the constant rise in inflation and the economic downfall as well. How is this going to affect the country in the long run in terms of food security? Should we really be worried about what we're putting into our fridges, whether we buy in bulk? Because sometimes people are saying, you know what, it's better to go and buy in bulk because food prices are so high. Let's start with you, Professor.
Yeah, it's a reflection of how one of the terrible legacies of apartheid, we were not taught an African language. And therefore, I didn't unfortunately hear what you understand what you said.
All right, no, it was basically telling us about most of the points that we've spoken about, Professor, and basically what causes
we do have to worry
food
about
shortage.
food security, and it means a change, change in attitude, change what we should do, and that should be discussed by experts like this as to how we should cope with that.
Doctor?
Well, I would definitely say buying in bulk is not necessarily the answer, because we can end up buying in bulk and then throwing
It's
away
too
a lot
much,
of it
yes.
because if it's too much. So we must really be careful before we start buying in bulk. When you buy food, look what the sell-by date is and the use-by date. And if it is something that you're not going to use before the use-by date, don't buy it because you're going to end up throwing it away anyway. If you buy food to store for longer, then rather look at processed food that is tinned or that is frozen or treated in a way that it lasts longer, and therefore the use-by date is a good guideline there. And we also often find ourselves being tempted by buy two for the price of one promotions.
Special offers, yeah.
Yes, and we must understand that in the end, if we don't eat everything that we buy, we end up buying more and paying more for what we actually need. Even though it's perhaps a bit more expensive to buy just the amount that you need, you may end up saving money because you don't throw away stuff.
Very interesting indeed. Now, Doctor, I want to understand, understand ukuthi research ikhona lapha for valuable reasons, but to what extent is lama results enwatholayo actually get implemented?
I-results zethu ziya implementwa njalo. Ezinye zezinto esizenzayo siyakwazi ukwandisa lento okuthiwa i-shelf life yokutya.
Okay.
Ukutya ebekwazi uhlala insuku ezintathu siyakwazi ukwenza ngenye ixesha kuhlale insuku zibe 5 ngokusebenzisa izinto ezithile ezizakwenza ukutya kube ngathi kuyaqhwayiteka kube ngathi kuyapreserveka. Ezo zinto ke we believe uba ngaba ziyancedisa ku food security because indawo ezininzi zikude nendawo ukutya ukusuka kuzo, okunye kunakale phakathi kwale ndawo kusuka kuyo nale ndawo kufanele bakuye kuyo. So iyancedisa ke lonto into bangaba sibe sisenza thina uphando ngokwandisa i-research shelf life yokutya. Lonto siyibona ibalulekile ku agriculture.
Very interesting indeed, Doctor. Let's take Bryce from Egiyani. Bryce, sakwamukela ohlelweni kwilungelo lakho.
How are you?
We're very well, thank you, Bryce. Please go ahead with your question or comment, sir.
I wanted to ask if how well the government is playing their part, because food are being produced in large number in our country, but the prices, the cost in the prices make us poor because every day we plant, we do everything, but when we go to the shops, we find that food prices are too high. How part is the government playing on that? Because you have seen that Private Governor was making his budget speech, and you have seen that food are raised because petrol prices are raised. How is the government going to resolve that so that we youth can have that courage to do more planting in our backyard? Because I am from Guyana, from rural community. There we have land, we plow, but we don't have that much support. I wanted to ask how the government is going to solve that for us. I thank you.
Thank you so much, Bryce. Well, we wish we had somebody from government here to tell us exactly what you need to hear, Bryce, but unfortunately, we'll tackle that issue when we come back. Let's see if the panel can, shed some light. Okwamanje mbukela ke sithathe elinye ikhefu ungayindawo email ama views akho kwi topic yethu ye food security. Siyabonga ngama email enisithumele wona kanye nama tweets nama Facebook messages. Ungayindawo siyabuya khona manje. Mbukeli, welcome back. Sesizolivala uhlelo kodwa phela ungashesha usifonele noma usithinte ku Facebook na ku Twitter nangayo futhi i-email akethi sibone futhi ama Facebook messages wenu ukuthi nithini lapha emakhaya. Let's see. Abel Mate uthi it is really sad ukuthi some people go to bed without eating if it affects the children at school because they can't concentrate. So I think our community leaders must do something about this. Thank you so much to Abel Mate. Malibongwe Bele Manyonya says uhulumente makakhe amaphulo azokufundisa abantu malunga nokulondoloza ukutya kuzanywe ukunciphisa izinto ezibangela ukusolakala phela kokutya, the like of climate change. So kuhle ukuthi silwe ingcambu engenabanela ukuba kubekho ukutya okulahlwayo. Yo sisimalibongwe. Okay, ngiyabonga kakhulu ngaloyo mbono wakho. All right, panel, let's wrap up our discussion very quickly. I know, Doctor, would you like to address Bryce Egiyani very quickly?
Into ebalulekileyo zimbini ngokutya. Ukutya xa kwenziwe xa kuproduce kule ndawo kusiwe kwenye indawo kukhona transportation costs, kukhona ne processing costs. ezo zinto ke ziyanyusa ixabiso lokutya. Ukuba ngaba ukutya kusuka kwindawo ekude kuziswe nge-aeroplane or kuziswe nge-truck or kuziswe nge-train which is cheaper, liyanyuka ixabiso lakho. Abantu bethu mabazame ukuziproducela okwabo ukutya kwezo ndawo bahlala kuzo. Urhulumente uyancedisa ukubonisa abantu ukuba ngaba ukutya kukhuliswa njani, izityalo zikhuliswa kanjani. iLimpopo Department of Agriculture kulaa mntu usuke eGiyani bangamnceda kakhulu, ahamba ayobuza kubo. Kukhona nento ekuthiwa ngamagosa ezolimo ancedisa abantu ukukhulisa izityalo abazawusebenzisa for ukwenza ukutya. Bayakwazi nokubheka kwi-Department of Agriculture nationally, bayakwazi nokubhalela kwindawo ezifana ne-Agricultural Research Council bacela uncedo khona. Siyabancedisa abantu ukuba ngaba bakwazi ukuzikhulisela kwabo ukutya so that ixabiso lokuproduce ukutya lizokuhla. Ukuba ngaba kusuka kude usually kuba ne-markups ezininzi kuthi kufikelele etafuleni kube sekungasafikeleleki ebantwini abaninzi.
Wegqirha, so kungcono umbukeli njengoba esho udoctor ukuthi yazini kunokuthi uthenge lento ethatha iminyaka ukuthi ifike kuwena, why wena ungangeni lapha emva kwendlu wakhe wenze something, wenze imfino yakho noma wenze indima yakho lapho in the back of your house. Ladies, let's wrap this up. Doctor, please give us any amicable solutions that people can save and elongate the food life from the foods that they buy, Doctor.
Well, I would say, first of all, let's pay the food the respect that it deserves, because not everybody has the opportunity to eat every meal. So therefore, if you buy food, keep it as short as possible in the heat. Make sure that you refrigerate it as soon as you get home, especially if it's perishable food, like fruit and vegetables. Then also, just prepare the volume of food that you're going to eat. Don't over-prepare, because if we over-prepare, we tend to throw the rest away because people don't like eating leftover food.
Absolutely, yes.
And also, when you prepare food, look first what you have in your house and use that to prepare your meal before you run to the shop to buy even more, because in the end, we just end up wasting.
Thank you very much, Doctor. Professor, this stage is yours. Please tell us your parting words.
Yeah, well, I would like to say we have a Minister of Health at last who cares. He's bringing in a new program of primary health. Primary health includes health promotion, which includes nutrition. Now, I'd like to ask Dr. Andrew, because it's so important. It seems to me he's not getting enough help, because he's very supportive of both Operation Hunger and community actions, trying to do, which needs to be spread out.
Absolutely, yes.
He hasn't got the funding, he hasn't got the help. The Department of Agriculture, in my opinion, should be working very closely with the Ministry of Health to try and help a lot of NGOs that can be brought together to work in partnership with government. We could do so much more. Absolutely. But what we find is we get no help from the, as I said before, from the local governments in Limpopo, in wherever, Mpumalanga, Northern Cape, wherever they're working. No cooperation from them, no funding, nor does the Department of Agriculture, I don't think, even know what we're doing. I'm not being critical. I'm saying it needs people. How do you get the Department of Agriculture and the Department of Health to get together with NGOs who are doing this and actually put a strategy in place? We could do so much.
Well, Professor, you've just done it. There is the doctor right here, and I'm sure the doctor, is there anything else you just want to add very quickly to the Professor's comments and remarks there?
I think the most important thing is for us to join hands and join forces and try to do things together, rather than each organization or each institution doing a particular thing to try and bring down hunger in the country. It is better for us to join forces and join hands so that we avoid duplication and we exploit what synergies exist between the organizations. I think one of the biggest problems in this country is that people do separate things towards the same end.
Absolutely,
I think we have to
yes.
try
And I think that's where the
it.
bridge is as well, because, Doctor, you can't really determine if your government who wants to take the money into their own pockets as well, which is why, you know, there's not a lot of funding to go around, Professor. But thank you so much, panel, for your insightful views today. Ayikembukeli kanjalo nje sesiqedile thina ebesize ngakho namhlanje. Ngithanda ukuthatha leli thuba ngibonge izivakashi zethu ngesikhathi nolwazi labo. Ngiphinde ngibonge nani babukeli ngokubamba iqhaza namhlanje. Remember ukuthola impinde ezinhlelo zethu hlangana nathi khona la kumahamba phambili SABC 1 Monday morning 9:30 to 10:30. Join Sisanda Jonas next week for another live consumer topic of the week. For myself, Alicia Ntombi Akajali kanye neteam yonke elungelo lakho, nisale kahle.
Yilungelo